I love the name of the podcast, American Potential. Americans have the potential and innovation and ideas to figure out a problem and how to solve it. And so if all we need is bureaucracy to kind of step back, don't put restrictions, help people do their things. I mean, there is, free market health that's trying to create an Amazon-type platform for healthcare. There's UberDoc that's trying to get direct access. But all of these innovative ideas, in addition to direct primary care, what has is the direct access. They're relationship-driven. And what we recognize is that innovation needs to come at the physician level with physician leadership and let businesses, because business leaders are doing a good job, which is generating profit. But we really need physician leadership back in healthcare.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, and welcome to the American Potential Podcast. I'm your host, David Fromm. Do you ever feel like that the healthcare system is confusing and expensive? Well, you're not alone. These days, just because you have insurance doesn't always mean you actually use it or get the care you need for it. Between high deductibles, endless hoops to jump through, and doctors only seeing you for one issue, the system feels like it's working against patients, not for them. But what if there was a way to cut through all the red tape, bring doctors and patients closer, and make healthcare easier, cheaper, and truly focused on your well-being? That's what direct primary care, or DPC, does. In this episode, we're going to talk about how DPC is offering an alternative to the traditional healthcare system. Our guest today is a pediatrician who left that system to start her own practice. And I want to welcome to the podcast, Dr. Chaminie Wheeler. Dr. Wheeler, welcome. Thanks for joining us.
Thank you so much. It's an honor to join and to talk about transforming healthcare.
That's fabulous. I'm so excited. Now, where are you located? Where do you practice out of?
So I practice out of Kutztown, Pennsylvania, right off of a big roadway, 222. We draw patients from Lehigh County, Northampton County, and Berks County.
Excellent. Well, so let's just go back to the beginning. Now, you're originally from Sri Lanka. Am I correct in that?
Yes.
Nice. I heard that you actually have some interesting stories about animals. Any ones you want to share with us?
I do. One of the, when they say, hey, tell us something about yourself, one of the things I usually say is that I've been chased by a monkey. And what that means is I grew up in a village in Sri Lanka, and we had these huge rubber trees in the backyard that big monkeys were there. And there's a little baby monkey that fell. I was probably 8 years old or so. And I picked up the baby and wanted to help the baby and took the baby into my arms and ran and was taken. And the mom was not happy, came after me. I ran, and finally I went inside my house. The mommy monkey actually chased me through the house, around outside of the house, until I dropped the baby. And then I came back, shut the door, and hid. So, yeah.
Oh, wow. That's super dramatic. It chased you in the house by a monkey.
I know. Yes.
Well, maybe 8-year-old you, though, kind of was a foreshadowing of what you wanted to do with your life by being a pediatrician, wanted to help kids of all species.
Yes. That's true.
Yeah. Well, so what made you want to practice medicine in the first place?
Well, in high school, I was part of Happy Club, and our sole goal in Happy Club was actually to fundraise money for Operation Smile. And Operation Smile, worked to help put smiles on kids with cleft lips and cleft palates. And talking with those doctors and it was very inspirational. I was naturally talented in math and science, and that just seemed like the perfect fit. Actually, I wanted to be a pediatrician even then. So it wasn't I wanted to be a doctor. I actually wanted to be a pediatrician. So it was kind of cool that I was able to do that.
Yeah. Gosh, that organization, you said it was Operation Smile. I've seen that, and it's so transformative and so cool. I'm so glad that you guys are
Yeah.
raising money for that, and that opened the door for your career. So
Right.
fast forward, you're practicing in a hospital setting. What were some of the issues that you saw that impacted the doctor-patient relationship?
So in a hospital setting, you're in these big four walls with that when you look around, that seems like everything is there at your fingertips. But the two things that really is missing is care and time. Time meaning in the hands of a doctor, you're given a census that you need to round through and get through. So you try to do your best to get through the rounds and round on all of your patients. But you end up sacrificing the quality of that care sometimes to be able to give somebody else who needs more care some more time.
Mm-hmm.
So in that becomes very difficult. And then the other really difficult thing that happens is the insurance regulations in the hospital setting to practice. You are constantly thinking not what's best for the patient, what will insurance pay for? Like, for example, a child with a pediatric child with a headache, often one of the things that once we've taken the differential diagnosis, and if we're still thinking the child needs imaging, one of the things that we want to rule out is a brain tumor. They don't have head bleeds just out of the, so really the study that will be best suited for that child is an MRI, not a CAT scan. But often in a hospital setting, we have to order a CAT scan and prove to the insurance that, oh, now we need the MRI. And it really is shackles a doctor's hands, and it does a disservice. We take an oath that says do no harm, but really one head CT is about 11 months of radiation in the sun 24/7. So we needlessly put radiation into this growing, developing brain. Now, get me, one head CT is not going to do anything bad, but a child's brain is growing and they have a lifetime of medical imaging left. So if I could have avoided that, I should. But there's a shackle. The patient really needed what they needed. And I have to do what I can to do that in the hospital setting.
So how does insurance kind of actually end up being a barrier for patients and end up leaving some folks effectively uninsured?
That's a great question. We have this concept, just as long as you hold this insurance card, that we have coverage, and somehow we have this false sense of security. But that coverage does not translate into care or access. For example, of somebody with, say, we did annual blood work and their hemoglobin A1C isn't diabetic, maybe not even completely pre-diabetic, but it's going in that trend. So in our clinic, we are able to say, hey, this trend, if you continue it, you're okay at age 30, but by age 60, you might be on 2 meds if this trend continues. So let's reverse that right now and let's do these lifestyle modifications. Well, insurance says that hemoglobin A1C can only be repeated annually because they are not diabetic. Medicare sometimes will pay for it twice if you are diabetic. So what does that do? It hinders that patient from getting better because all the hard work they're doing to reverse that inflammatory process of having that high blood sugar in their bloodstream is they give up. A year is a long time. In our clinic, we're able to repeat that. It's a couple of dollars the testing actually costs. It doesn't cost very much money, but the amount of years of inflammation we can prevent so they don't develop chronic renal disease. They don't end up on dialysis. All of those, they have good vision, eyesight. They don't get ulcers. They have good neurological input. They may not fall as much because their nervous system works better. I mean, I can go on and on. So that's a care that is hindered. And then access. When we look around, that if you have a sore throat, often you call your doctor's office, you can get in. Maybe 5 days, 2 weeks. Whatever that scenario is, that's the symptom of lack of access is why I believe there are urgent cares in our community. Because patients still need to be seen for that sore throat, but that the system by nature is designed to make more profit because now you be seen in an urgent care and that generates more profit for the system. My dad right now has insurance, every alphabet soup of Medicare letters that are offered. And so he has all of this coverage, but he needs to see a urologist. He has to wait 6 months. So he went to an urgent care, was prescribed antibiotics for urinary tract infection that he didn't have, and was that blood work that we still don't have the results for. So made money, and it actually, I can say, did harm to him because he was given antibiotics when he didn't have an infection that destroys his gut biome, and then all of the other consequences of that. So it's our system is ill, and we really do need to fix it.
Yeah, I believe you. That resonates so true with like so many stories that I've heard just personally. But it's also a barrier for providers like yourself. I mean, so what are some of the things that are making it harder for independent doctors to, keep their practices going in practice?
100%. So even like for opening up an independent practice, first thing you have to do is negotiate with insurance. That adds 30% to your overall margin to be able to open the practice because of all the negotiations that you have to go through. And then once you've negotiated to be able to see these patients, then all these things you want to do needs prior authorization. So why do we need a prior authorization? Because there's an insurance company, some administrator in an insurance company saying this test is not worthy, even though the patient paid for that insurance and are continually paying for a service. There's a doctor that's saying this needs it. So if we look at that healthcare in the doctor-patient relationship in that bond, there is a need, but something outside of that relationship, outside of that covenant, that trust between the doctor and patient is regulating the care. And we can go on and on and on about it, but it's a huge barrier.
Well, so you decided to open up CCC Health, right? A direct primary care facility. So what makes that kind of a game changer for both you as a doctor and your patients?
Absolutely. It really is a game changer because we really take away all that red tape. There's zero negotiating with insurance. We have zero portals with all of these billion insurances, and so that decreased our cost to be able to actually open our practice. And the game changer is that the whole relationship is the profit motivator. For patients' perspective, they have access, they have care, and they know that their doctor is there for them 24/7. Our patients don't have to go to an urgent care. Now, they do need insurance if something big happened, catastrophic, and go to the ER, cancer, surgeries, all of those things. But I've seen patients on Christmas and on Easter, in the holidays. And it's a very easy thing for me to do because I know that family, their relationship, is easy for me to go in, see them, look in the ear, say, yes, this is what's going on. And, let's oftentimes I can tell the mom because I know, give it 24 hours, see if we can get over it without starting this. But if it doesn't, start it. I can text with my patients. So from a patient's perspective, that access and care is 100% there. From a physician perspective, it is just incredibly rewarding. There's a physician burnout and a physician shortage all-time high. Why? Because we don't get to be able to do what we went to school to do. Direct primary care, there's not an unsatisfied direct primary care physician across the country from coast to coast, because we get to do what we went to school to do, which is to take care of our patients and make them better.
Yeah, that totally resonates with me. Just full disclosure, I actually utilize a direct primary care physician ourselves. And he, just to tell that quick story, he was a great doctor that we really bonded with, who loved him with all our kids and all that. And he moved towards this model. He had been at a hospital, he had his own practice, but he moved towards this model and has really embraced it. And I think, you can tell that he's just happier. It seems like he's living his best life.
Right.
And it works great for us because the attention we get. He actually does home visits which is kind of fun.
Wow, that's
Yeah.
wonderful. We thought about doing home visits, but we have not done that yet. But our practice is by a Mennonite community, so we do have
Oh,
people come in
yeah.
with a horse and buggy, so which is kind of cool.
Yeah. We're all just going back in time a little bit. It's great.
Yes. Yes.
So something that can help patients when it comes to paying for healthcare would be using their health savings accounts or
Yes.
HSAs for their DPC membership. First, can you explain what a health savings account is and how it would help?
Absolutely. I think HSA is a second game changer that we need. HSA is health savings account. It has 3 tax benefits in that you get to put money into it tax-free. The interest on it is tax-free, and any withdrawal for medical expenses is tax-free. So what does that do? It truly transforms where the money for patients goes back to the patient's pockets to be able to have control and choice of their own healthcare as well as their healthcare dollars. Unfortunately, DPC membership, according to IRS regulations, is not healthcare, which is crazy when we that's all we do is take care of patients. So actually in the One Big Beautiful Bill, the House did have that provision in to expand HSA and really even for our seniors and to really increase that. But it was taken out of the Senate version, which I think is a really a loss for patients and for healthcare transformation overall. And that's because of the Congressional Budget Office said that there was a $45 billion loss of tax revenue predicted over the next 10 years, which is a true statement, I'm sure. But what they failed to look at is the other side of that equation, which is $67 billion of anticipated healthcare savings annually, not over 10 years, but every year. So they didn't look at that portion of it. And we really do need HSA because we need primary care to come back and be that groundwork, that solid foundation, what healthcare is made out of. And if the better the primary care, studies after studies have shown, the better access our patients have to their doctor and more robust their primary care is, the less it costs in healthcare. And that's what HSA would do. Simple as that.
I couldn't agree with you more. Just to be honest, it feels like, we've seen these consolidations of medical practices and doctors just, really getting sucked into all these massive hospital kind of control practices. And this movement, the DPC movement, I think is so healthy and good. And I think one of the best things, there's a lot of great aspects to it, but one of them is, we really, as an organization, believe in people, really finding fulfillment, really being able to chase their dreams and do what they feel like they're best equipped at. And I imagine so many doctors got into practicing medicine to help people and to deal with people directly and help them solve their problems. And preventative care is the best kind of care because it saves us all tons of money on the back end and saves lives, of course. Right. But man, it's just like, we kind of can't get out of our current system in a way to just recognize some of those truths.
Right. No, it is the best system. And what's really nice is that it's not trying to eliminate the current system, but we just need HSA to be expanded so that we can compete with the current system and let the patients be the one that ultimately decides where they want to spend their healthcare dollars is all we're asking. If the patient wants to have the traditional insurance model and all of that, they can. And if they want to choose something else, we're just asking for them to be able to do that.
Yeah. So you mentioned the One Big Beautiful Bill. Obviously, part of that's the Tax Cuts and Jobs Act. We've been talking about that legislation a lot as a podcast over the last number of months. We think it's such an important piece of legislation. My understanding is that it played a role in your decision to open up CCC Health a number of years ago.
100%. So, opening a practice is it's a daunting, costly endeavor. And the 100% depreciation that we were able to take the first year of opening our practice was a truly remarkable great game changer. We don't have the pockets with nonprofit hospitals that they can, because they don't pay taxes, to be able to open urgent cares and another center and another center. This giving that as a business to give that depreciation 100% upfront allowed us, we know that the first 3 years of a business is the hardest to get going. And giving help to a business to get going was truly a game changer for our practice.
That's great to hear. We've heard so many great stories from around the country in all kinds of industries, just different types of organizations and businesses, where how helpful it's been. And gosh, we got to keep push that one over the goal line. I got one last question, before we wrap up. It's a little more historically focused. So, direct primary care is kind of a newer innovation. Mm-hmm. And I think, we'd probably agree has a real potential to transform American healthcare, and certainly the relationships between patients and doctors. What are some historical examples of new concepts that were introduced in the healthcare world that made a difference for patients over time?
Sure. So when we look at healthcare in a historical context, why are we here where we are, where everybody knows healthcare is broken? And why is that? So I wanted to, so if we actually look at like World War II, the European healthcare system developed, and it's because after World War II, the countries were devastated. They had no infrastructure. So the government really was the only was able to build that and to provide needs that their people needed. In the United States, we had an infrastructure, but we had this tax system where it goes back to the taxes, right? Where money is. Where businesses had a hard time making ends meet. So one of the things that happened is insurance came in, and businesses were able to take a tax advantage by offering insurance as a benefit package. So what it ended up doing is that we ended up tying jobs to a benefit package and really to healthcare, which is kind of crazy when your job determines the health you get. And so that's where we are today. And I can say that with that, employers ended up doing more into the benefits package, and even growth of salaries didn't happen to the same rate because they were added more to the benefits package. So from an employee and an employer, they were trying to pay less in taxes. So there was these two systems that's developed, but they're both riddled with things that are wrong, that are not working. And so even though we could say, oh, well, the intentions were good and noble, why they developed the way they are, we can measure something based on intentions, but the actual results. One actual result is my brother from, in Sri Lanka, which is modeled after the European healthcare system, was born with a tumor in his brain. Because that tumor wasn't life-threatening, and my parents were, we had means in Sri Lanka, took him to the best doctors that there were. He did not have that operation, and he grew with that mass until we actually immigrated to the United States, and he had the surgery here as a teenager. So his care was delayed that long in that system. And he has lifetime consequences of motor skills because of that. So that would never have happened in the United States. So there's good things about our healthcare system. But what we have to do to transform healthcare is these innovative models need to allow to thrive. I love the name of the podcast, American Potential. Americans have the potential and innovation and ideas to figure out a problem and how to solve it. And so if all we need is bureaucracy to kind of step back, don't put restrictions, help people do their things. I mean, there is, Free Market Health that's trying to create an Amazon type platform for healthcare. There's UberDoc that's trying to, to get direct access. But all of these innovative ideas, in addition to direct primary care, what has is the direct access. They're relationship driven. And what we recognize is that we really innovation needs to come at the physician level with physician leadership, and let businesses, because business leaders are doing a good job, which is generating profit. But we really need physician leadership back in healthcare so we can care for our patients, have access for our patients, make it affordable. And direct primary care really is rarely do you have increased quality and decreased cost. And that's what DPC does, so it's innovative along with all these other models. And we can thrive as patients. And my biggest call is that patients learn about all of these models, because at the end of the day, it is us as patients that control every dollar that's in the healthcare system, because we pay for it, even though we don't feel like we have any control. So every dollar that you can use to buy your medicines from a local pharmacy that's a small business, an imaging center, a local lab, all of those things help move the needle in the right direction to have that doctor-patient relationship-driven healthcare.
Yeah, that's great. Dr. Wheeler, I really appreciate courageous leaders like you going out and starting a business, kind of forging away on this. This is a great innovation, like you said. So I really appreciate you joining us and talking to us about direct primary care.
Thank you so much for this time and this opportunity. We're passionate about this, and so thank you for giving us a voice.
Sure. Thanks. Well, folks, as Dr. Wheeler said, Americans love innovation. And, we pride ourselves on being a really innovative country, but it kind of seems like healthcare gets stuck or it gets stifled. And, doctors like Dr. Wheeler are changing that and giving patients more options so they can be more in control of their health. If you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel, as well as following us on Facebook, Instagram, and YouTube. And always remember, liberty and freedom are easily taken for granted. Don't take it for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.